Dr. Nelson, I'm glad we're talking today because we are seeing definitely a pandemic with the COVID-19 happening, but also a pandemic with people having addictions right now, and that's where you come in to help. Let's talk a little bit about what you do.
Well, Brad, about 10 years ago, we had a discovery where our daughter, we found out she was a heroin addict. And when heroin is about somebody else's kids or something you read on the news, you know, it's like, okay, that's horrible. When it hits home, anybody who's dealt with heroin addiction, it's a black vortex of emotions that draws an extended family into it. Our life revolved around trying to help get her well. And over the course of the years, she wasn't able to do so. The help that she was able to get didn't suffice. She had a lot of relapse, a lot of horrible things. And then it got to the point where we weren't wondering if she was going to die. We were just waiting for the call that she had overdosed. And I was able to help her and discovered a treatment that was able to help her get sober. She's been 6 years sober now. And after that, I felt like it was my obligation to other families to help provide that same service. So I came into the addiction treatment not as a plan, but as a necessity to help my own family, and then that allowed me to help others.
Yeah,
so that's what I do.
And Doctor, your story is probably a story of a lot of parents hearing this, but also a lot of parents who are trying to deny that with their children too. Not my kid. And I think that was the one thing that woke you up a little bit going, this is my child, let's see what we can do. And so the program that you developed, let's talk a little about that.
Well, the thing that we do is, first I would say, everybody wants their kid to be sober, and they want them to be sober yesterday. And sobriety and recovery happens on the time frame of the person suffering from the addiction, not from the people that want to help. And so before we get someone sober, we want to do something called harm prevention. And harm prevention is, one, everybody who has opiate, heroin, or fentanyl addict in their family, they need to have a Narcan kit. A Narcan is an injection that can be given if someone overdoses and they don't breathe. We have those in our office, and we provide them free to all of our patients. So if you have someone, you can call our office and we can provide that. The second part of harm prevention is free needles. We don't do a needle exchange, but there's a number of needle exchange programs here in the Valley that will prevent people who are an addict, and if they do use needles, to prevent them from having Hep C or HIV. And then lastly, fentanyl is a drug that's come on the scene in the last 5 years. And it's important for everybody to know that the drug that they're taking probably has fentanyl in it. And that's the one that kills people. It's 100 times more potent than heroin. Wow. So those three things are harm prevention or harm reduction. And then what I do is a treatment called a Naltrexone pellet insert. Naltrexone is an opiate blocker that miraculously does two very important things for the recovery of a heroin addict or a fentanyl addict. One, it blocks the drug from having its euphoric effect. And then two, it takes away the cravings that makes recovery so difficult, because the cravings is what causes them to relapse. Wow. That's why so many people are passing away from this dreaded disease. Prior to COVID, it was the thing that everybody talked about. The Surgeon General says it's the #1 public health concern in the United States.
And it's not going to go away unless we have someone like you who's helping these families, these people try to get through this. And I know you do it in a couple different ways. Really quick, what's the name of your podcast that I know that you ask people to come listen to?
Yeah, so the podcast is Your Road to Personal Addiction Recovery. We've recorded about 135 episodes.
So, and then where's the website they can find out more?
You know, our website is explorehealthaz.com. And for those of you that are interested, we also provide a service for alcohol. It's called Sinclair Method. And simply, you take that same drug, but rather than putting it in an implant, you take it orally 1 hour before drinking. And as ludicrous as this sounds, I've had hundreds of patients that go from drinking way too much down to what's considered to be a normal drinker. So that's something that 12-step and abstinence, they don't talk about. But I've seen great clinical efficacy with that.
That is so great, Doctor. I mean, this is so important to have you on, especially at this time. And we hope people go to the website, find out more. And so, Dr.
Yeah, can I ask one last thing?
Yeah, sure.
We're going to offer for people that want to learn more about this. It's hard to learn in sound bites, so we're going to offer 2 free 1-hour webinars coming up. You can sign up on our website, and they're free. And then you can sign up, and then you can ask questions, all sorts of things. And those are going to come up in the next week. We'd love to have anybody and everybody interested to come on there.
Wow, doctor, that's amazing. Again, tell people the website.
It's explorehealthaz.com.
Thank you very much, and thank you for doing
Thanks, Brad.